Guys, welcome to Dental Board Reviews. And so today we're going to review Operative Dentistry. If you haven't subscribed, make sure you subscribe so you can receive notifications for the upcoming reviews. Okay? All right. So, which material will wear the opposite tooth the most? So you know some restorative materials are very coarse and they can wear the natural teeth. Okay? So is it composite, amalgam, porcelain, or gold? Okay? So our answer here is porcelain. All right? Okay. And then the next one is C factor is the ratio of what? Okay? So C factor is the ratio of what? So if you know C factor in restorative dentistry, you should be able, you should know this. So is it A, the ratio of bonded to unbonded surface area, or is it the ratio of unbonded to bonded surface area? Okay, so our answer is, if you don't know the definition of C factor, make sure you look up the definition of C factor. Okay, and you need to know this if you're going to be doing restorative dentistry. Okay, so C factor is the cavity configuration. Okay, so C is for cavity configuration. Okay, factor. So configuration factor for the cavity is defined as the ratio of the bonded to unbonded surface areas. Okay. All right. Let's talk about calcium hydroxide. So calcium hydroxide is useful for pulp capping because of what? Why is calcium hydroxide used? All right. A, it strengthens the subsequent restoration. It encourages dentin bridge formation. It stops and prevents pulpal bleeding. Increase bond to restoration. So does it increase bonding to restoration? Okay. So our answer, as we know with the reason why we use calcium hydroxide, is B. Okay. It encourages dentin bridge formation. So, which of the following is correct about zinc oxide eugenol? So, zinc oxide eugenol, why do we use it, and why? Which of the following is correct? So, zinc oxide eugenol provides a seal, have a palliative effect, meaning a healing or soothing effect, a palliative effect, provides thermal insulation, not easy to remove from cavity, or the above. Okay, so does it provide a seal? Yes. Does it provide a palliative effect? Yes, we know that. And thermal insulation, all these things. So you know the answer is E, or the above. Okay. All right. It is best to use glass ionomer base for composite restoration. True or false? So it is best to use glass ionomer as a base for a deep composite restoration. True or false? Yeah, that's true. Okay. So glass ionomer providing iron, fluoride, so fluoride ions, to make sure that the tooth becomes stable and can remineralize, okay, forming that bridge formation decrease sensitivity, but also, okay, provide a better seal than just a pure composite by itself. So glass ionomer will provide more addition of the fluoride ions. So this is true. So what wavelength of light is used for light activation for composites is in the range of what? So the wavelength of light used in the light activation of composites is in the range of that, okay? So 400 to 499 nanometers. All right. All right. Acid etching. So acid etching is very critical to our restorations. So acid etch technique reduces micro leakage compared to not etching. Is that true? Is it false? Yes, it's true. So if you etch well, if you acid and etch, you're increasing the chances you're increasing the energy of the tooth, okay, of the cavity for better bonding. Okay, so this is true. Okay. Now, if you're going to be using restorative material, you should be able to know how bonding occurs. So how does bonding occur? So bonding occurs primarily by what? Okay. So it occurs primarily by micromechanical retention. Okay. And if you don't know some of these, make sure you review. Okay, you review your operative dentistry. Okay, so you can review these concepts. Don't just memorize them. Okay, so these are reviews. So if you don't know, make sure you go back and look, at each section or at each question carefully. Okay, so you can know the concept. All right. And if you haven't subscribed, make sure you subscribe. Click the bell notification so you can receive notifications for the new reviews which will be posted. Okay. So the prevalence of dental caries has been declining the past 40 years due to what? So why is the prevalence of dental caries declining? All right. So is it because of increased use of fluoride, provide oral hygiene, emphasis on disease prevention and control, better access to dental care, or the above? It's going to be all the above. All right. So all these have contributed to a decrease in dental caries. So, which bar is ideal for occlusal preparation? All right. So if you're a dental student, you know that the best occlusal preparation that is going to give you some nice convergent walls. Okay, not too convergent, but nice convergent walls, just because of the shape of the bar, is going to be the 330 bar. So the 330 bar is the bar which is ideal for occlusal preparation. Okay, we're talking about ideal. That means you can use any bar you want. Okay, but what is the ideal for the preparation? It's 330 bar.